Well, welcome everybody to tonight's lecture. I'm going to talk tonight about water intake, and the title of the talk is The Truth About Water Intake, Myth, Risks, and the Sweet Spot. And water intake is a very confusing topic. You talk to your friends, they'll talk about their thoughts about how much you should drink. Different doctors give you different recommendations. And I'm going to go through the current thinking about it and also some of the misconceptions, which are important. So here are some of the misconceptions. The more water you drink, the healthier your kidneys are because you make them work harder by flushing them out. That's not true. When you're thirsty, you're always very dehydrated. That's also not true. You must drink 8 glasses of water a day. That's a very common misconception. That's also not true. Drinking more detoxes your body and creates healthier skin. Untrue. Only plain water counts towards your hydration. Also untrue. Drinking more water slows down the progression of CKD, CKD being chronic kidney disease. That's not been proven definitively. And this is not an exhaustive list. This is just some of the misconceptions. Now, what about the role of water in your body? It's important to realize that water makes up about half of your weight in a woman, and I'll show that in more detail, to 60% of your weight. So if you take your weight and you're a woman, divide it by 2. That's how much all the water in your body weighs. Man's a little bit higher in percentage. Your body depends on water to survive. Every cell, tissue, and organ in your body needs water to work properly. Water helps get rid of waste through urination. You also lose water through perspiring and bowel movements. Water keeps your temperature, helps keep your temperature normal. It also helps lubricate your joints, and it protects some sensitive tissues. So these are more layman type sentences. At a molecular and cell biological level, it's much more complicated than this, but just to give you sort of general categories and concepts. Now, where is water in your body? Your brain is made up of 75% water. Your blood is 83% water. Your heart around 80%. The bones are the lowest, but you can see that if you just take all the different organs and tissues in your body, water makes up a very great percent of each. Now, back to the sort of common question, how much fluid do you need a day? And I'll interchange fluid and water as I'll show you. It's not the water you drink per se per day, but how much total liquid you drink in the form of coffee, tea, soup, et cetera, et cetera. So one of the issues is there's different recommendations depending on the agency or the guidelines that you look at. So in the United States, there's the U.S. National Academy of Sciences and Engineering. There's the American Heart Association, the AHA, and there's the Academy of Nutrition and Dietetics. And they suggest that in men, you should drink about 15.5 cups of water a day, and women is a little bit less, about 11.5 cups. The CDC in the United States doesn't have a number. They mentioned it varies with activity, age, sex, and pregnancy. In the United States, the UK, excuse me, the National Health Service recommends 6 to 8 cups per day, and they don't distinguish men and women. The European Food Safety Authority, men less than in the US, 10.5 to 11 cups a day. Women also less than the US, 8.5 cups a day. And in Australia, we have slightly different numbers. So you get different recommendations depending on the country you're in, which should suggest to you this is not an exact science. Otherwise, everyone would agree. Now, there are different ways to assess fluid intake, just like we have different units of temperature. We have Fahrenheit, centigrade, we have with your weight, pounds and kilo. Those are called units. So you could think of it as either 8 glasses a day, which is 64 ounces a day, which is 2 liters a day. And a cup and a glass are the same. So you'll hear cups or glasses. That's confusing to people. Now, one of the issues is drinking water is socially pushed. There's a lot of pressure to drink water all the time. If you've spent any time on social media or visited an athletic event, you've likely been bombarded with encouragements to drink more water. There's celebrity influencers carrying gallon-sized water bottles as the hot new accessory. Twitter bots constantly remind us to drink more and be hydrated. Some reusable water bottles come emblazoned with motivational phrases like remember your goal or keep drinking or you're almost finished to encourage you to drink throughout the day. And then there's purported benefits of excess water consumption that are seemingly endless, from improving your memory to mental health to giving you more energy to helping your skin. And phrases such as stay hydrated have become a new version of the old salutation, stay healthy. So there's a lot of PR for drinking water that we're constantly bombarded with. And this confuses people, especially people that have underlying medical conditions. How much water should I drink? What what about the advice that I always hear that I should be drinking 8 glasses of water daily? Now, the other concept that people don't think about is that they only think of intake, the input into the system. But we have what's called dynamic water intake and output. There's water coming in and there's also water leaving. It's like this container here filling up with rainwater. Well, water leaves doesn't only come in, it also comes out. And that's very important because you're not a garbage can that can just fill up with water because you're drinking water. We have losses of water. And that's very important because it comes down to the question, if I drink a glass of water, how long does it even stay in me? You know, we urinate and we have loss of water through the skin and we breathe water. So there's this very important concept of water intake and water output. And that determines how much water you end up at any point in time in your body. So water intake can come from pure water or drinks. There's also water in fruit. And also water is actually created de novo by the biochemistry of your cells, depending on what you ingest. You can ingest something that has no water in it, and your cells in your body actually create water from it. So there's a certain amount of water created every day. And then we have different sources of water loss. We have loss through our skin. We breathe out water. We have water loss in our stool, and we urinate. And all these together add up to what you took in. So if you take in X amount of water, you're going to lose that same amount of water in a day. You don't change the amount of water in your body. You only change it momentarily when you drink until it comes out. The output is not instantaneous. So it's like a car where you put gas in the car, but the amount of gas in the car doesn't stay constant because well, with a car, you're burning the gas. With your body, you're actually getting rid of the water that you take in. So again, water intake and water output. We take a glass of water in, it takes about 3 hours to get rid of that glass via your kidneys. That's all it stays in your body. Doesn't stay in any longer if you have normal kidney function. The kidney regulates how much comes out after you lose through your skin and your lungs and your stool. That's sort of an obligatory fixed amount. The kidney is the main regulator of getting rid of the rest. So when you drink a glass of water, most people have the misconception that you've done something that stays in your body and keeps you healthy for a day. You're actually peeing that out in 3 hours. It only stays in your body for a short time. Now, we can also think about what percentage of our body is made of water. I showed you the organs. A newborn is mostly water. 80% of the weight is water. A healthy adult male is 60% of the weight is water. And as I said before, half the weight of a woman is water. So if you weigh 120 pounds, you have 60 pounds of water in your body, roughly. Now, there's also this concept of dehydrated or well hydrated. Few people talk about overhydrated, but what's shown here is the normal amount of water in an average human being. And if you have that amount of water, we call that you're hydrated. Or if you want, you can use the word well hydrated, even though that's not a medical term. So in a man, there's about 42 liters of water. That's 42 kilo. Each liter weighs a kilogram. A woman has less water in her body in total, plus women tend to weigh less. We use the word dehydrated if a man who normally has 42 liters loses water from the body and has, let's say, 40 liters or 39 liters, that we would call dehydrated. On the other hand, if that person now has 44 or 45 liters of water when they normally have 42, that's called overhydrated. So you can think of it as gas in the car. How much gas do you have in your gas tank? If you have less gas than you normally optimally have, then you're dehydrated. If you put too much gas in the car, you're overhydrated. If you have just what the average human being has for your age and height, then that's not called anything. You're just hydrated normally. So if you think about it, let's say a man who weighs 155 pounds, 92 pounds of that weight is water. A woman who weighs 115, she has 58 pounds of water. And that's something that people don't realize is that water changes from day to day as far as the amount in your body or what changes the scale. You know, a lot of women weigh themselves daily on the scale and they go, or men also, they get very upset if the weight goes up a pound or down a pound. That just changes in water from day to day. The daily changes in weight are on by far due to water changes, not because you're getting fatter or less fat or gaining muscle or not gaining. Those changes take much longer to occur. The rapid fluctuations are just fluctuations in water intake. So let's just take an average male who weighs 155 pounds, who has 42 liters of water in their body, and they're drinking 2 liters of water a day. What happens is they lose 2 liters of water a day. The input and out, the concept is your input and output are equal if you're a normal medic, if you don't have a disease. Whatever you take in comes out. And that keeps the amount in your body constant from day to day. There's an input and an equal output. Now, as I said before, not all the 2 liters come out via the kidney. The kidney gets rid of the majority of the 2 liters. The rest are being lost through your skin, a little bit in stool, and you breathe out water. But most of the 2 liters on the output side is due to the kidney. Now, what happens if I change the 2 liters? Let's say I suddenly, for some reason, and I wouldn't recommend this, drink 12 liters of water a day. Well, the kidney will just put out the extra 10 liters. And so you'll still have 42 liters. The kidney if you increase your water intake, the kidney can go up to around 12, 13 liters of water a day. And it'll recognize that you went up on the input side and it'll just pee it out. So when you decide today you're going to try to drink more glasses of water to keep yourself healthy because you heard that your friend's drinking 17 glasses instead of 10 glasses a day or whatever it is, all that is just going to end up in your urine. You're not going to keep that in your body. On the other hand, if you decided you don't feel like drinking at all today and you drink a half a liter a day, which is a quarter, let's say roughly two glasses of water a day, or excuse me, less than that. Half a liter a day half a liter is a quarter of what the 8 glasses are, so 2 glasses a day, your kidney is going to recognize that you drank less and it's going to pee less. You're going to create less urine and you're still going to have 42 liters of water in. So the concept here is that we can have wide changes on the intake, and the kidney, just if you have normal kidney function, will recognize that and match the output. So it's very hard to get changes in the amount of water in your body by changing the intake, because your kidney just normally recognizes that and makes sure that your input and output are equal. And that's why people that think they're going to do something to their body by drinking, I think this is water that's in Japan. It's like $1,390 per liter. It's just water. But there's people that actually drink this and think they're doing something to their body, and all they have is a very expensive urine. It's all going to come out in the urine. And so you're just taking the $1,300 and putting it in the toilet. So again, input and output, always equal. Now, there are diseases where the input and output will not be equal. Those are diseases that affect the kidney's ability to get rid of water. So people with liver disease, certain forms of kidney disease, and heart disease, and again, these aren't general words. It depends on the type of liver disease, kidney disease, and heart disease, have a problem getting rid of water. Their kidneys aren't able to get rid of water normally. And so, depending on their intake, they can start retaining water. They go into what's called positive water balance, where the intake and output of water are not equal. And it just depends on the severity of the impairment. So some people have such a severe impairment. As I said before, the normal kidney can excrete up to 12 liters a day. So if you have, let's say, impairment from these diseases and you can only excrete 6 liters a day, as long as you're under the 6 liters on your input, you're fine. So let's say you have kidney disease or liver disease and your kidney can only get rid of 6 liters. If you're drinking 2.5 liters a day, you're not going to retain the water because your kidney can get rid of the 2.5. It's only if you go above the 6 liters that you get into trouble. In this example, this patient has such severe impairment that they can't even get rid of the 2.5 liters a day. They can only get rid of 1.5 liters. So if they drink more than 1.5 liters a day, they're going to go into positive water balance. They're going to retain water. So this person's drinking 2.5 and getting rid of 1.5. They're going to have in that day an extra liter, and they're going to go from 42 to 43 liters of water in their body. Once you start gaining 3-4 liters of water, you start getting swelling. And the swelling tends to accumulate in your feet because of gravity. So when you stand all day, your ankles get swollen. The water is just being retained or shifting down to the ankles. When you go to bed at night and sleep, the swelling goes away because the water gets centrally transferred, and you pee it out. It doesn't get retained in your ankles. So people who have ankle swelling, or what's called edema of their ankles, tend to have it worse at the end of the day when they've been standing all day, and it's not often visible in the morning. Or you could have the opposite occur. You could have excessive water loss from sweating, vomiting, diarrhea. Not mentioned here are some kidney diseases where the kidney inappropriately puts out too much water. And unless you match that on the input side, you're going to get what's called dehydrated, where the amount of water in your body will fall below normality. So instead of having 42 liters in your body, you'll have 40 liters. And that's manifest as fainting or low blood pressure. The fainting occurs because when your blood pressure drops, it causes your brain to shut off and you fall to the ground. It's a reflex to make your blood pressure go back to normal. So when you have loss of water from your body, that's manifested clinically as low blood pressure, as opposed to too much water in your body that's manifested as edema. So how do I know if I'm hydrated enough? How do I know I have, the right amount of water in my body? And another way of asking that is, how do you know how much you should drink? And the answer is your body will tell you when you should drink. That's why thirst was created. That's why we have thirst. When you're thirsty is when you should be drinking. If you don't feel thirsty, in general, you don't need to drink. The notion that staying hydrated in most people, and I'm assuming now you don't have any diseases, and I'm assuming that your cognitive function is fine. You don't have Alzheimer's or diseases that can affect your ability to sense thirst. Assuming all that is normal, most the thought that most people require complex decisions to avoid the dire health consequences of dehydration is simply incorrect. It doesn't require a lot of Socratic thinking or planning, or Excel spreadsheets or writing down lists of how much you drank and how much you didn't drink. All it requires is that you're aware of your thirst. And one of the best things to do is to stop overthinking it. Now, I'm talking about normal people who have normal kidneys, normal heart, a normal brain, normal liver. Your body evolved to have the systems, and not just your body, animals have the same sensation. When you need water, you get the sensation of being thirsty. And also, it shuts off when you don't need the water. So when your thirst goes away, you know you've had the appropriate amount of water to drink. Now, there are exceptions. As you get older, your ability to experience thirst decreases. So you have to be aware of that. The assumption here is that you can experience thirst normally. If you're not not experiencing thirst normally, then you won't necessarily know when to drink and how much. Now, the converse question can occur. Whether you should drink more depends on whether, not that you should follow some guidelines. So the question we're asking now is, are there situations where you should go beyond your thirst or where you don't want to rely only on your thirst? And there are, in certain conditions or certain situations, where you have to worry about excessive water loss. So we're really asking here, when should you go above your thirst? When should you think that maybe I want to drink more to stay safe and not go on the line of becoming dehydrated and dropping my blood pressure? So the factors to consider are body size. People that are very large can have excess water loss and may have to, in some situations, worry about drinking more than just their thirst. Or it could be very hot outside and you're sweating a lot. If you have excess water loss from sweating, or there are conditions where people are extremely nervous and lose a lot of water, or they can have genetic conditions where they perspire a lot and can lose liters of water through their skin. These people need to potentially think of drinking more. Or let's say you have some lung condition or neurologic condition where you breathe very rapidly or you're breathing a lot. You may lose more water than someone who's breathing 15 times a minute. Or as I mentioned, you're excessively sweating for some reason. Or you have some underlying condition like kidney stones where it helps to drink more than just based on your thirst to try to keep the calcium in your urine at a lower concentration to prevent the formation of kidney stones. And, an example of a 200-pound person who hiked 10 miles in the heat needs to drink more than a 120-pound office manager who spent the day in a temperature-controlled building. Some of these things are obvious. It's people who are in the temperature-controlled building who are sitting all day, who are drinking a huge amount of water all day. That's sort of the inappropriate situation. And again, it's futile because that water is just coming out in the urine. You're just taking all the glasses of water that you drank that you thought you were helping your body with, and you're just urinating more. And that becomes an issue for people in their 60s and 70s and 80s and 90s who tend to get up throughout the night and lose sleep because they have to go to the bathroom and urinate. I always say in your 60s, you get up once, in your 70s, you get up twice, in your 80s, you get up 3 times, and in your 90s, you're up the whole night. So the concept of drinking more water, even when I'm not thirsty, will that improve my health? Is that right? And the answer in general is absolutely not. You're not going to be improving your health by drinking more if you're already healthy. And there's also some misconceptions because a lot of athletes will drink a lot of water before a race. And in general, athletes who blame the feeling ill after they've done that on being dehydrated may actually be drinking too much water and getting overhydrated. And they're feeling not well is because they have too much water in their body. They overdid it. And there are certain patients with heart, liver, and kidney disease, they may need to decrease their water intake. Remember, they have a problem on the output side. Their kidney is not getting rid of their daily water intake normally. And if they continue to drink even a normal amount, they may get edema. So they have to decrease the intake to match the decreased ability of the kidney to get rid of water to prevent overhydration. Another question that comes up commonly is, do I have to drink water or can I drink other fluids? And the answer is not necessarily. There's nothing special about water. Water is a better choice than um, um, other options. There's typo there. Other options like sugary sodas or fruit juices. But when it comes to hydration, any beverage will add water to your system. So if you're just talking about the amount of water in your body, it doesn't matter. If you're talking about other things in the drink like sugar, yes, then it does matter what type of liquid you drink. But if you're just asking, how do I stay hydrated or how do I keep the amount of water in my body normal, it doesn't matter what the fluid is. One popular notion is that drinking beverages with caffeine or alcohol will dehydrate you, excuse me. That is totally untrue. Caffeine does not dehydrate you. There's this thought that caffeine increases the flow of blood to the kidney and the kidney works harder and you create more urine that way, and that's how you get dehydrated. But in general, that's not true. In 2016, there was a randomized trial of 72 men, and the conclusion was that the hydrating effects of water, lager, coffee, tea were all nearly identical. There's no difference in their ability to give you fluid or water. You can also get water from what you eat. Fluid-rich foods and meals like fruit, vegetables, soups, and sauces all contribute to your total water intake. And as I mentioned before, there's also the metabolic processes which can take some solid foods and turn them into water in your body. You generate water, actually, small amount. And then in the context of talking about water, you'll hear people talk about electrolytes. So there are electrolytes, which are other chemical substances like sodium, potassium, chloride, magnesium. These are electrically charged minerals that are present inside your body and they dissolve in water. They're in all the fluids of your body. Wherever there's water, there's electrolytes dissolved in the water. And they're important for the normal functioning of really all the cells in your body, nerves, muscles, brain, heart. But this is not an exhaustive list. It's all the cells require electrolytes to be at a certain concentration. But from sport drink ads, you might think you need to constantly be replenishing your electrolytes. But there's no scientific reason for most healthy people to drink beverages with electrolytes added. You get enough electrolytes from all the different foods you eat. You don't need to be ingesting electrolytes in a particular drink unless you have a ton of sweating or unless you're an athlete that can lose inappropriately electrolytes that you need to replenish quickly. The other important thing to be aware of is that the intake of these things and the retention in your body are coupled. When you take more salt in, it tends to prevent the kidney from getting rid of the water that you take in and causes you to retain for a longer period of time the water that you took in. So if I take in 2 liters of water with a ton of salt, it's going to take me a lot longer to get rid of the 2 liters. The kidney will hold on to that 2 liters for a longer period of time. And that will then keep more, it'll create overhydration in your body, which will cause edema and also increase your blood pressure. That's why salt increases your blood pressure, because it causes water retention. For the same amount of water, you have 2 people, both drinking 2 liters. One accompanies the 2 liters with salt, and the other is on a very low salt intake. They took in the same amount of liquid. In one person, the blood pressure will go up, and in the other, it won't, even though they took in the same 2 liters. And it's because the water will stay in their body for a longer period of time. Plus, the salt tends to cause the water to shift out of the cells and into your blood vessels. So there's more water. There's an internal shift of water when you take in more salt, independent of what you took in from the outside. And the other thing to know with electrolytes is, there's some medical issues that can occur if you take in too much potassium, for example. In some patients, it can alter your heart rhythm. In fact, that's how you can stop the heart from functioning. If I inject too much potassium into your veins, I will actually stop your heart. So it depends whether you're able to get rid of potassium normally, and people who have normal kidneys don't have a problem with that, but people with a lower EGFR have less of an ability, or severe CKD have less of an ability to get rid of potassium, and they have to watch their potassium intake. So just willy-nilly taking in electrolytes in a drink, first of all, is not needed in most people. And secondly, if you have certain diseases, can be dangerous. Now, excess water intake over a short period of time can also dilute your blood electrolytes and can be dangerous. If you drink water or any fluid at a rate beyond what your kidneys can get rid of, the electrolytes in your blood can become too dilute, and in the mildest case, you won't feel well. But in the extreme case, drinking an excess amount of water in a short period of time can lead to a condition called hyponatremia, or diluted sodium. It's a fancy way of saying diluted sodium or diluted salt in my blood, as an indication of too much water in your body. And if the sodium levels or the salt levels get too low in your blood, it can cause your brain to swell, and you can get seizures, coma, and even death. In 2007, there was a 28-year-old woman who died of hyponatremia, this dilution of salt in her blood, after reportedly drinking nearly 2 gallons of water over a 3-hour period while taking part in a radio station's Hold Your Wee for a Wee contest, which challenged participants to drink water and then go as long as they could without urinating. She actually died. In 2014, a 17-year-old high school football player in Georgia died from the condition after drinking 2 gallons of water and 2 gallons of Gatorade. So, yes, the input and output are equal. Whatever you drink can come out, but it doesn't come out instantaneously. So if in a period of time you drink an excessive amount of water, given the delay in the kidney getting rid of it, remember I said it takes 3-4 hours. But if you put in a ton of water in over a very short period of time, the kidney cannot get rid of all of it. And the more you take in, the more you're going to get overhydrated. And so you have to be very careful, because overhydration can lead to brain swelling. And the brain, when it swells, actually, because of the skull is fixed, the brain actually goes through the base of the skull and destroys all. It's a horrible thing. It's called coning. And you die from it. It just strips all the nerves off the brain. It's a horrible situation that occurs. So the bottom line is, drink only when you're thirsty. If your heart and kidneys and liver are normal, you don't need to drink 8, 9, 10 glasses of water a day. If you do, it's not going to harm you. But remember, all that water is just coming out in your urine. So the minimum amount you need to drink to stay healthy should be based on your thirst. And If you drink more than that, you're not causing your kidney to get rid of more toxins. You're not making your kidney work better. You're not preventing diseases. Um, there's really very little evidence that you're doing anything if you have a normal heart, brain, and liver and kidney. And remember, there's an expense to it also. People don't just drink water. They're drinking all sorts of fancy things that they think are going to help their body. Everything you put in is coming out in 3, 4 hours. All that you can think of it as dollar bills. You're just putting it into your body, X amount of dollars, depending on how much you're spending. And those dollars are going into the toilet. And you're only getting a period of 3, 4, 5 hours where those dollar bills are staying in your body. Remember the concept of input and output. Now, if you have diseases, then these recommendations change and should be based on what your doctor recommends. But in general, if you're not cognitively impaired, you have a normal thirst mechanism. We've evolved to have this system to tell us exactly how much water we should be drinking. So in general, drink when you're thirsty. And I think I'll stop there and take any questions if anybody has any. No questions?
Any comments on distilled water and also pH? I think it was negative water.
Yeah, again, that's all PR. pH, the whole idea of acid base and acidity in water is a huge misnomer because the acidity is due to something called hydrogen ions or protons, and the amount of protons that are actually in water is so infinitesimally small that whatever the pH is of the water, you're not going to be changing the pH of your blood in any way. There's also oxygenated water. There's all these ways of making your wallet lose its dollar bills to spend more money in the store. So pH balanced water, distilled water, deionized water, oxygenated water. It's something just to get you to spend more money. Doesn't do anything for your body, doesn't harm your body, and doesn't make it better. So you might as well just drink, um, the purest water you can. Now there is the concept of drinking water without chemicals in it. I mean, water from the tap in certain cities is not as safe as drinking deionized or distilled water. That's clear. But in general, the water that's put into orange juice or the water that's put into soda, that water is chemically pure. You don't have to worry about it. The water that's in your soup, you have to think about it. Don't use in general water from the tap if you don't have to. But again, that has to be included in your total water intake. The water that you have in your tea, the water in your coffee, the water in the milk you drink, if you have cereal, that all counts towards your total fluid intake.
How do you spell MO?
And they all have the same effect on thirst. They all have the same effect on your thirst.
Side effects of water.
If you're thirsty, it doesn't matter if you drink a cup of orange juice or soda or distilled water.
Are you missing minerals if you drink only distilled
Well,
water?
that's what I was talking about, electrolytes. So the minerals, another word for electrolytes is minerals. And that you get from all the food you eat. There's minerals in your chicken, there's minerals in your potato, there's minerals in your cabbage, there's minerals in your salad. You don't have to add minerals to water to get minerals. And minerals, again, is a general word which doesn't mean very much. It's sort of a lay term. You have to break it down into salt, potassium, calcium, magnesium, phosphorus. Those are all different electrolytes, or what you can call them minerals if you like. But that you can get from all the solid food you eat. You don't have to put that into water to get it. Everything you eat, whether it's cereal, a potato, piece of cabbage, a steak, a hamburger, a hot dog, corned beef, all have minerals. You don't have to get minerals from the fluid that you eat or fluid that you drink.
Thank you.
Dr. Kurtz, I drink a lot of sparkling water. Can that be harmful?
No, so sparkling water is water with carbon dioxide. And remember, carbon dioxide is the gas that you breathe out when you're breathing out. And the carbon dioxide that comes in with the liquid in sparkling water or soda, you just breathe out. It goes into your body and you get rid of it. You exhale it. So all the bubbles that are in the drink, you breathe out through your lungs. Totally not harmful.
Thank you.
Can you hear me if I ask a question?
Yes, I can hear.
Thank you so much. I loved your lecture. I want to ask if your feet are swelling, if your legs are swelling, does that mean you're intaking too much water, or could that be due to like other medications such as blood pressure medication?
Yes, so swelling in the leg, swelling, first of all, occurs in the ankles mostly because for whatever the medical cause, because of gravity, the fluid tends to stay there. Now, then the question becomes, what is the cause of the swelling? One cause is that you're overhydrated. You have too much water in your body. That can occur because, and as I said, the kidney normally can get rid of whatever you take in, so that doesn't occur. But if you have liver, heart, or kidney disease, certain diseases, the kidney cannot get rid of the water that's coming in. And one way, and so you retain the water and it stays in the ankles. Another way to get around that, if your kidney defect is fixed, is to just cut back on the water intake. Now, we generally don't just cut back on the water intake, we cut back on the salt intake because, as I mentioned before, when you take in more salt than you should, that causes water retention. For a given water intake, you tend to retain more water. So we treat that by cutting back on the salt intake to start, and then if that doesn't work, we then add to that cutting back on the water intake. And you should see the swelling decrease. That's if you have a problem of water intake and output. Now, another reason for swelling of the ankles is it's not a water intake output problem, but it's a problem with the veins in the leg, and the veins become too leaky. And that can occur, when you get into your 80s and 90s. The veins are not able to send the fluid back to the heart normally, and they become more leaky, and the fluid stays in the ankles also, but it's not a water input output problem. It's a vein insufficiency, venous insufficiency problem. That tends to occur in one side and not the other initially. So, I mean, if it's a water intake output problem, it usually is both ankles. If it's one leg more than the other, it tends to mean there's an issue with the veins. Then there are also some blood pressure drugs like the calcium channel inhibitors that can cause some fluid retention. And that you just stop the pill and it gets better. Having fluid in the leg a little bit is not a horrible thing, as long as it's not too much. I mean, it's inconvenient and your shoes don't necessarily fit all day, or it's hard to get, your shoes on. As I say, it tends to be better in the morning when you first get up because you're not standing, and it gets worse towards the end of the day. But in general, we divide up fluid in the legs by water input output problems, which are liver, heart, kidney, versus venous vein problems, which have nothing to do with water intake and output. I tend to see that in
So having it is not necessarily an indicator of something dire is going to happen, and it's something you should be treating.
Right. It's not per se something that needs to be treated. It depends on what the cause is.
Right.
We tend to treat the cause rather than and then so that we treat the chicken, and which is the liver, kidney, or heart disease, and the egg is the edema, which goes away if we can treat the chicken.
Right.
But having it per se doesn't lead to any dire. I mean, if it's very severe and it's going up half the leg, and the leg is very swollen, that can lead to some problems with blood supply to the leg, and it can also affect the venous flow. Also, just the fluid is so under high pressure, and there's so much of it that can actually affect the flow to the leg, the arterial or venous flow, and that is in and of itself is not good. In general, we don't worry about having the edema or the fluid there. If it's mild, it doesn't lead to anything. It's more an issue of what the cause is. So the cause is the chicken, and the egg is the edema. We go after the chicken. We try to fix the heart problem or the kidney problem or the liver problem that's causing it. Now, if the swelling is extremely severe, let's say it goes up half the leg, the skin is very tight, there's a ton of liquid there, ton of fluid, that per se can lead to problems. It can block the flow of blood in the veins. It can block the arterial blood flow. And if you get problems with blood flow in and out, the artery takes blood into your leg and the veins take the blood out of your leg back to your heart. If those blood vessels are compressed because of the high amount of fluid and pressure there, you can end up with abnormalities of the skin, breakdown of the skin. You can end up with an infection, all sorts of other issues in the leg that you'd want, and that we would treat per se. We would treat that independently of the cause, or try to treat that independently of the cause. But if it's mild or not too severe, then of course we're interested in knowing why it's there. You'll be worked up for a heart problem, liver problem, kidney problem. There's another cause that I didn't mention, and that's what's called a low albumin in the blood. The most prevalent protein in your blood is called albumin. That's what the name of it is. That's what egg white is. Albumin. It's what egg white is. Egg white is pure albumin. And so, but it's also a protein that floats around in our blood, and it keeps fluid from leaking out of your blood vessels. It's a physical force. It's called oncotic pressure. It keeps fluid in your blood vessels and keeps the fluid from leaking out into the outside tissues. So people who have a very low albumin also can have swelling of their ankles. And we have to look at their protein intake, because the albumin in your blood correlates with how much protein you're taking in. So that's another reason that has nothing to do with water input and output. It has nothing to do with leaky veins. It's a separate cause that we look at. So when we see swelling, we think of all these different things and try to ameliorate the cause if we can. But in general, should not worry about mild amount of fluid in the ankles, other than the inconvenience and the worry about it. But it's not going to lead to anything detrimental.
Thank you.
Doctor?
Yes.
The diagnosis.
Yes, I'm 85 years old. I have chronic kidney disease and I'm stage 4. My creatinine is around 3.6, the GFR somewhere around 1920. I also recently developed a kidney stone in my left kidney, 3.6 millimeters. How much water should I be drinking?
Well, that's a good question. I would stay 2 liters or under. I mean, at that level of CKD, you have some inability to get rid of your daily water intake. If you probably went up to 5 or 6 liters, your kidney probably would not be able to get rid of that amount of water. So as long as you stay under 4 or 5 liters a day, you're not going to become overhydrated. But in general, your kidney should not have a problem getting rid of 2 liters, 2.5 liters a day. You do have the other issue of the kidney stone, and in general, we try to prevent kidney stones by increasing the amount of water intake. It also has been found that a low salt intake can prevent future kidney stones. It's something people aren't aware of, because on a low salt intake, the kidney holds on to calcium much better, and the calcium concentration in the urine drops. A low salt intake makes the kidney absorb calcium much more efficiently. So I think if you can stay on a low salt intake, that'll also help with your blood pressure. Keep your fluid intake around 2 liters a day. you should be fine. What's happening with the kidney stone? Is anything being done about it?
It's lodged. It's lodged, your kidney stone. He's asking about your kidney stone.
I'm
It's
sorry.
lodged. No one's doing anything.
My urologist is just watching it. It's not.
Okay.
It's not in the.
Urethra.
I can't urinate it out.
Well, as
The
long as they're
location.
watching it, as long as they're aware of it and watching it and it's not going anywhere, it's not going to cause any issues. You'd like to try to prevent future stones if you can. I would stay on a lowish salt intake as much as you can tolerate it, and don't go above two. Stick around 2 liters a day, which is 8 glasses. You should be able to tolerate that. If you find that on 8 glasses a day you're getting swelling of your ankles, it means you can't excrete even the 2 liters. Just cut back. But again, remember that there's a coupling to salt intake, and the less salt you take in, the more water your body will get rid of in the urine. There's this water retention that occurs when you take in more salt. That's why salt affects blood pressure. It doesn't really make sense intuitively, because the pressure in your blood vessels is due to the fluid in your blood vessels, but salt affects blood pressure not directly. It makes the blood vessels have more fluid in them, so the pressure goes up.
Thank you, doctor.
Cut back on the salt.
Cut back on the salt.
And also that will help prevent future kidney stones. You'll get a double bang out of the single modification.
And on that topic, may I ask, are salt substitutes okay, or do they have the same
Well,
issue?
that's an excellent question too. Salt substitute is potassium. So sodium chloride is salt is made up of 2 electrolytes, a sodium ion and a chloride ion. And the salt substitute is a potassium ion with chloride. So your brain has a hard time distinguishing the taste of sodium chloride versus potassium chloride. That's why it's called a salt substitute. But the problem is, if you have CKD, as your kidney function decreases, your ability to get rid of potassium decreases. So you don't want to put too much potassium into your bloodstream, because your blood potassium can go up. And recall, as I was mentioning before, if your blood potassium goes too high, it can affect your heart rhythm. Potassium, all the cells in our body have a voltage. It's called a membrane potential. So there's an electrical voltage across, like a battery. All the millions and billions of cells in our bodies have an electrical potential, and that is determined to a large extent by potassium. And so when you change the potassium concentration in your blood and your cells, you affect that membrane voltage. And it's very important in the heart, because you have a little, so-called pacemaker cell in your heart. These cells are spiking in voltage every second, and that makes your heart beat. So you have an electrical system in your heart that every second is firing off. And that causes the muscle to contract. But the first thing that occurs is the electrical. And that electrical part is very dependent on the potassium concentration, or the so-called salt substitute, or one of the ions in the salt substitute. It's the potassium, not the chloride. So if you have CKD, your kidney can't get rid of, and it depends on the level of CKD. If you have end-stage renal disease, you can't get rid of any potassium in your urine. We have to remove it with dialysis. But as your CKD gets worse and worse, you have this gradual decreased ability to get rid of potassium. And so you have to modify your intake. And that's what people do. As the ability to get rid of potassium goes down, you just cut back on the intake. You match
bananas and potatoes.
Well, bananas and potatoes and watermelon, any fruit, there's a lot of potassium. So potassium, but again, it's the kind of thing not to overthink, because you don't want to globalize things and ruin your life and ruin the things that give you pleasure. You don't have to cut back on the potassium unless you have documented high potassium in your blood. So you need to make sure when you go to the doctor, you don't just know your creatinine, EGFR. Ask them, what's my potassium? If he says it's 3.5 or 4, you don't have to worry about your potassium intake. If he says it's 5.5 or 6, the doctor themselves will tell you, watch what your potassium intake is. So, and again, in general, a lot of this is just common sense. Don't make modifications unless you have empirical evidence that you need to. Don't try to treat yourself just based on what I say or what you read on the internet. You don't have to worry about the salt substitute unless you have a documented inability to get rid of potassium normally. And that again is in a finite subset of people. It's not something that the population has commonly. Most people have no issue at all getting rid of their daily potassium intake. But yes, potassium is in bananas, orange juice, all fruits. It's in all meats and fish. You can remember the acronym PP, not the usual meaning of the word PP. But PP stands for protein and potassium. Everything that has protein in it has potassium.
Right.
Except for fruits. Fruits have potassium without protein.
Mm-hmm. No fruits.
Thank you.
Okay.
Any other questions or anything anyone's worried about?
I have a question.
Sure.
In my family, we don't have thirst. My mother, my sister, and I can go all day without drinking. I'm not really sure why. So the three of us force ourselves to drink all during the day. Is there something that can cure that we do have thirst?
Well, there are neurologic conditions, there are genetic disorders where you don't experience thirst normally. Are you saying you never feel thirsty, or you just feel that your thirst occurs less than other people you know for the same water intake?
My mother and I and my sister rarely, very rarely feel thirst.
Mm-hmm.
I think it's genetic.
Yeah. It sounds like it's something in the family. One has to distinguish not experiencing it versus not caring about it. The sensation is there, but it's not something that enters your consciousness or that will lead you to drink. It's not a very strong sensation. So, I mean, there are different degrees of feeling it, and there's different responses to it. So it's sort of a complicated issue psychologically. But in general, if you don't experience thirst and you're worried about that, don't overdo it. Again, you only need to drink a liter or two a day, which is 4 glasses of fluid a day. I don't just say water, but total fluid, up to 8 if you want. But again, I don't think it's anything you have to worry about. In general, there are people that have different degrees of feeling thirsty. That is true. That's why I was asking, if you went for a whole day, would you still not feel anything? Or is it just less intense than most people?
No, I get to the point where I think,
You get
oh,
worried,
I haven't drank all day,
right?
and then I'll drink something. But I would say, and my mother's the same way. We don't
Is it the same with
experience
hunger? Is it the same with hunger? Can you go a whole day without eating and you don't feel hungry? Or is it only water?
only water.
Mm-hmm. So you experience hunger like most people.
Yes.
Mm-hmm.
And I only have one kidney. The right kidney was removed. So still,
Why was that?
Dr. Chamey, I had ureter cancer
I see. When was it removed?
7 years ago.
Can I ask how old you are?
70.
Okay. Normally what happens when the kidney is removed, the first thing that happens is you have half your EGFR, you have half your kidney function. So let's say you're walking around with a kidney function of 100. When you take one kidney out, it goes to 50, immediately goes to 50, assuming both kidneys were contributing roughly equally, which is a good assumption.
Well,
So,
I was told it was my stronger kidney.
well, they're not always exactly
Right,
50,
equal.
but they're not much different than, let's say, 48, 42. You know, they're close. They're close. Um, um, or excuse me, 52, 48. They're close. But what happens is after that kidney was taken out and you follow the remaining kidney over half a year to a year, what you find is the remaining kidney starts to grow. The body somehow um, knows biologically that your kidney function decreased. And what you find, and you can do x-rays and show, the remaining kidney grows. And actually, in some people, if you do this in younger people, their remaining kidney can actually take on the function of two kidneys. And so the kidney function, so you find the EGFR drops to 50, and then you follow that over time, it can go up to 75, 80, or 90, sometimes almost completely to normal. And so you don't end up with half the kidney function. If you do that in a 60, 70, 80-year-old, the remaining kidney will not take over as much of the function. But you only need, you don't go on dialysis till you get down to about 10 or 15. We have way more kidney function than we need. You have to get down to 15%, 10 to 15% of normal before you need to go on dialysis. So we have this huge reserve of kidney function. Losing half your kidney function does not imperil you at all as far as having to change anything. You can completely have a normal life with half the kidney function, even 30% of the kidney function. It's when you get down to 10 or 15 that you start having problems getting rid of water, getting rid of salt, getting rid of your potassium intake, getting rid of your phosphorus intake. You start retaining all these things because you don't have the input and output equal.
Yeah, I don't have those issues.
Yeah. What I was showing before with the water intake and output being equal, that concept occurs with everything. If you take in X amount of potassium, you're going to get rid of that amount. If you take in X amount of salt, you get rid of that. The kidney is a chemical computer. It recognizes every single thing you take in your diet and makes sure that it matches that with what comes out in the urine, and that keeps your blood chemistry constant. Because remember, 3 times a day, we do what's called eat, and when we eat, we have hundreds of thousands of chemicals coming into our bloodstream that could potentially significantly alter the chemistry of our blood. And the reason that doesn't occur is because we have this chemical computer called a kidney, which recognizes the whole periodic table and gets rid of everything you take in so that everything is matched, the input and output are equal. But it's only when the kidney function severely declines to 10 or 15% of normal that you stop being able to maintain the ability to excrete what you took in with your diet.
So one more question about water. So now I have ureter cancer on the other side. They treated it with Mito, Keytruda, and Pedsaf. Should I be drinking the 4 to 8 glasses a day still?
Well, again, if assuming that the ureter is open and there's no obstruction, and assuming your heart and your liver are normal, and your EGFR is, what is your EGFR? Do you know what your creatinine is and your GFR?
Well, they're very happy with it. It's 173 for the creatinine.
1.73?
Yes.
Yeah, that's not bad at all. That's good. So, I mean, your EGFR is probably what, 40, 35, 40?
I don't have it memorized, but
I'm guessing,
they're,
but it's
they're not worried
probably
about
30,
it.
it's probably 35, 40% of normal. Yes, you should be able to. I mean, you're not obligated to drink the 8 glasses of water a day. If you drank 4 glasses, you'd be perfectly fine also, unless
Okay.
you're excessively sweating or you're in a very hot climate and you're losing a ton of water. You take in 1 liter and that 1 liter gets lost through your skin. Yeah, you can get dehydrated because your kidney is going to be peeing out 3, 4, 500 milliliters and you're losing a large part of your skin. You're going to go into what's called negative water balance. So Yeah,
Okay.
as long as you're not in a very hot climate and you're not sweating a lot, you can drink, 4, 5, 6, 7, 8 glasses of water a day. It's going to make no difference.
Okay, thank you.
You have a wide range of water you can drink. Not just water, I'm talking total fluids, soup, coffee, tea,
Right.
all that.
Thank you very much, doctor.
Mhm. Anyone else have any worries or any
Yeah,
other?
I have a question.
Sure.
I'm chronic kidney disease 4.
Okay.
You were mentioning about how much of your your kidney is operating. So in chronic kidney disease 4, is there a rule of thumb of how much my kidney is working? What percentage?
Well, that stage is based off of so if you take 0 to 100, the CKD stages are based on what your kidney function is within a certain range. So um, each of them is it's an arbitrary subdivision. It's really a continuum from 0 to 100, and we arbitrarily divide them up into these different stages. But in fact, there's no it doesn't start and stop. It goes from 0 all the way to 100. It could be 1, 2, 3, 4, 5, all the way to, and some people have function over 100. Um, what you want to look at is what's called the EGFR. The creatinine is the actual blood test, and the amount of fluid your kidney is filtering is not the creatinine. That's the EGFR, but the EGFR is not a measurement. It's not an action. It's a calculated number based on a formula, and it's not exact. It's it's based on the creatinine, and the creatinine is put into a mathematical formula, and then out of the formula spits out the EGFR. But it can be off by 10, 15, 20% in a given person. But the general idea is that as your CKD stages get higher and higher, the EGFR gets lower and lower. The amount of fluid your kidney's filtering per minute or per day decreases until you reach what's called, stage 5 or end stage, when there's very little filtration left.
I see. The
But
doctor.
the idea is to also follow the trend. You want to try to get stuck at a certain stage, or sometimes even have the CKD sometimes slow down, or even sometimes reverse, which is very uncommon. But you don't want to be going from CKD stage 1 to 2 to 3 to 4 to 5 to dialysis. You want to, with your doctor, try to stop the trend over time and keep yourself at that CKD stage 3 or 4 or whatever it is, for the rest of your life, and not have it get progressively worse.
Yeah, so I have a follow-up question. So my issue from my doctor tells me that I have too much protein in my urine. So
Well, that's another.
does the amount of water influence the protein in your urine?
Yeah, that's a very good question, and I didn't talk about protein in the urine. So when we look at the important parameters for assessing kidney function and progression, we don't just look at the creatinine and the formula calculated EGFR. We also see whether there's protein in the urine, because in general, the more protein in the urine, the more the kidney is diseased and the more it will progress and get worse and worse as far as the creatinine and the EGFR. Normally, there's very little protein in urine. The kidneys don't let protein get into the urine. And when kidneys are damaged, we find there's protein in the urine. That protein, by the way, is albumin again. It's what's egg white, what egg white is made out of. So basically, when you say there's protein in the urine, the protein is the same exact chemical that you get from eating egg white, albumin. And it's the most prominent protein that's floating around in our blood, but it leaks out into the urine from the blood in people who have different diseases of the kidney. But to answer your question, water intake does not affect the protein in the urine. There are drugs that we give people to try to decrease the amount of leakage of protein into the urine. But
The other one.
changing your water intake in general does not affect the amount of protein that's in the urine.
Okay, as a follow-up to what you just said, should I be limiting the amount of the white part of the egg that I eat?
Well, everyone, whether you're healthy or not, or whether you have different diseases, whether it's cancer, kidney disease, heart disease, um, has a certain amount of protein that the dietitians recommend for your condition. And in general, a rough general rule is you should be taking in 1 gram of protein per kilo body weight. So if you're 70-kilo person, you should be ingesting 70 grams of protein a day. That's sort of the general average for an average human being. And then people modify that depending on the conditions that you have or don't have. But in general, if you're ingesting about 1 gram a day of protein, even if you're not, and again, a lot of this isn't a hard science. This is just sort of a general guideline to know that you're not going to be too far off. And a given individual is where the doctor has to maybe modify that recommendation. But the next question is not just the amount, but the type of protein. And egg whites are just a great pure protein to eat without carbs and fat. Egg white is like the best protein that you could ingest. If you had no other protein in the universe to ingest, egg white is great. There's no fat in it. There's no salt. There's nothing else that comes with it. And you can buy egg white, egg white liquid or powder and just make, fried egg or whatever, or different types of egg. But eating the yolk has fat in it. It's not healthy for you, especially if you have coronary artery disease and you don't want it, and you want to keep healthy blood vessels. Egg white is much healthier for you. And so, where do we get protein from? We get protein from meat, fish, yogurt, milk, cheese, and egg white. But the proteins are different. There's thousands and thousands of different proteins. So the protein in milk is called casein and whey. The protein in steak and a hot dog and a hamburger, different protein. Muscle is protein. It's made of protein. So, but egg white is a different type of protein called albumin, and a very healthy one.
I see. Okay, thank you for your response. Appreciate it.
Doctor, this is the 85-year-old with CKD. Can you tell me about Jardiance and
Yes, so these drugs came out several years ago, and they actually block sugar transport in the kidney. They have other effects too. They were found in large studies to also protect the heart, and they are also found to slow down the progression of kidney disease and many types of kidney disease. So they're one of the amazing things that's happened in the specialty of nephrology in the last number of years. These drugs that we have now available for the first time, and there's other ones too.
Tell them what happened.
There's other drugs out there too, coming down the pipe, and other classes of drugs. But in general, that drug in a number of patients can slow down the progression of CKD and prevent you from going to, from CKD 2 to 3 to 4. Initially, there's this initial bump in the creatinine with many of these drugs that scares doctors off, and they stop it prematurely. That's one of the things that happens with these drugs. They're often stopped.
What happened to you?
Or the insurance, there's problems insurance covering it. But as a class of drugs, they are one of the new class of drugs in kidney disease that
You're off it.
are being used. And again, they don't work in all people, and they don't work in all kidney disease causes of CKD. CKD is an end result of thousands of kidney diseases. It's not a disease. It's the chicken and the egg again. There's hundreds of chickens that can all lead to CKD. CKD is not one thing.
Your brother has it.
Now remember, the other issue is that people tend to forget, and most doctors aren't aware of, is that the EGFR decreases as you age. So in a 90-year-old, the normal EGFR might be 65 or 70, and they're misdiagnosed as having CKD. And that's a whole other issue. Whether the word CKD should be used with the decline of EGFR and the rise of creatinine, that is just an age-dependent change that's totally normal. And so many doctors don't recognize this, and they'll tell a 90, 95-year-old, you have CKD. And then your immediate retort should be, doctor, the EGFR declines with age. You should look that up and tell me if my EGFR is lower than you would expect for my age. Only then should you use the word CKD.
He's going to ask him for this.
Yeah, thank you, doctor.
But yes, you should always be aware of what your EGFR should be for your age. And the EGFR in a 50-year-old is not the EGFR in a 90-year-old. There's a decline of kidney function that occurs with age that is totally normal and is not life-threatening and should not be considered a disease.
But your brother has it.
But when you reach a certain level, you do go on dialysis when you reach stage 5.
Yes, but the normal decline looks like, stage 1 or stage 2, or it never gets as low as you would see for needing dialysis. The EGFR would go from 100 at the age of 50, let's say, to 65, 70 in a 90-year-old. It'll never go to 15, 10 or 15. It'll never get that low. Remember, the lower the number, the worse the kidney filtration.
Okay.
And the problem is these are all confusing things because they're all saying the same thing. People think they're all different. The creatinine is the measurement. The EGFR, the word E stands for estimated because it's not a measurement. It's a mathematical equation that can be off by 10 or 15%. And that reflects the amount of fluid the kidneys are filtering every minute or every day, whatever period of time you want to look at. The CKD stage is just saying, if it's filtration of this, I'm going to call it this stage. If it's a filtration of this, I'm going to call it this. But they're all saying the same thing. The CK stage doesn't give you any more information than the EGFR or the creatinine. They're all just saying the same thing different ways. They're all just assessing one thing, how much fluid your kidneys are. We have 1 million filters in each kidney. 1 million filters. Can't see them with your eye. And they all filter your blood, and they filter it at a certain rate. You can think of it like a drain in your bathtub. There's a certain amount of fluid going through the drain in your bathtub. And as you get older or get CKD, the holes get plugged up. The filter doesn't work as well. So it's just assessing the filters in your kidney. That's what the EGFR, creatinine, and CKD stage are. They're all saying the same thing. And that's different from protein in the urine. That is because the filter leaks too much. It can be blocked for fluid, but it can be leaky for protein at the same time. But we're assessing the filters. We're still assessing the filters with those tests. And the average male is born with about 1 million filters in each kidney. And those filters total together determine the total filtration, which is what your EGFR is, or your CKD stage, or lack of CKD. But as I say, the filtration has to get down to 10 or 15% of normal before you need dialysis. But the kidneys control a lot of things. They control your water intake and output. They control your sodium, salt intake and output, which is your blood pressure. They control your potassium input and output, which is your heart rhythm. They control your calcium balance, which is your bones. They make vitamin D, the active form of vitamin D, which is your
Should
skeleton.
you take D?
They
Should you take D?
Hmm?
Should you take D or anything?
Should I be taking D?
It again, it depends on what your vitamin D level is. If you're in the sun all the time, you probably don't need, but it's based on your blood level. The doctor measures your vitamin D level and then determines whether you need to take a supplement or not. You don't want it to be more than you need. And again, it depends on the patient. Some people have kidney stones, some people have parathyroid problems, people have bone issues, and that will modify the amount of vitamin D they should be taking. The vitamin D that you take is not the active form. That's a precursor to the active form that works on your bones. The kidneys turn the vitamin D pill that you take into its active form. And as your CKD stage gets worse and worse, and your kidney function gets worse and worse, the ability of the kidney to activate the vitamin D that you're taking gets more and more impaired.
Okay.
The kidney also determines whether you're going to be anemic or not. It makes a hormone called erythropoietin, which tells your bones to make more red blood cells. So the kidneys control a lot of different things in your body, which have nothing to do with urine or detoxification or filtration. They also
Brilliant.
these two, they make the
Brilliant.
vitamin D hormone, and they make the hormone that makes you have blood.
Are most kidney patients anemic a little bit, borderline?
Yes, yes. As your CKD stage gets worse and your kidneys get worse and worse, you become anemic because the kidney stops being able to make the erythropoietin hormone that tells your bone marrow to make more blood. So we have to give the erythropoietin as a drug.
What drug was it, did you say, to take? Any drug
No,
for the anemia?
it's called Epogen. It's made by Amgen. That's how Amgen became a multi-billion-dollar company
Really?
by cloning.
That's the name for him?
In the 1980s, they made synthetic erythropoietin.
That is
What's the name of that drug again?
It's called Epogen.
Epogen.
That's the brand name, Epogen. But the hormone, the medical name for the hormone is erythropoietin. Erythropoietin. It's made by the kidney, and then it goes into the bone marrow and tells, which is where your blood is made, in your bone marrow, and tells the bone marrow to make more red blood cells.
Okay.
Mm-hmm.
One quick question.
Hmm.
What is your opinion on vitamins?
Vitamins are not needed in general unless you have a vitamin deficiency. Again, it's a money pit, as are supplements. You don't need to take anything other than what you eat unless you have a deficiency, a medical deficiency of a substance that needs to be supplemented. But there's no evidence at all that taking a multivitamin pill does anything to your health other than deplete your wallet of dollar bills, which can affect your health.
Well, it's
I have
it's
a
an
question.
unregulated industry, so we
Yes.
really don't know what's in it, correct?
Well, that's a whole other very important point.
Yes.
That's a very important point. I mean, the
Mhm.
supplement industry is totally unregulated. You don't know, you can't even go by the label because that the content can change all the time. And there are people taking supplements that get into trouble because they have underlying medical conditions, and some of those supplements can be dangerous. So in general, the problem is there's this sort of whole industry out there, social media, whatever, of people thinking that there's these secrets out there that doctors don't know about, that they have found, especially people that are desperate with cancer and very severe diseases, life-threatening diseases. They will do anything to find ways to keep it, which is, laudable, obviously. But there aren't really secrets out there, unfortunately. And the whole supplement industry is a multi-billion-dollar industry that takes advantage of people. And, it's human nature to want to do anything you can to keep yourself healthy. But in general, the body is very clever. And most of the things that you need to stay healthy are in the foods we eat. And the body also has backup systems and complicated biochemical pathways. And so no matter what you throw into it, it's going to figure out what to do within,
Kidney patient, each one.
within a wide range. Unless you have severe organ diseases, then you have to limit what you can throw into it. But in general, the answer is no, you don't need multivitamins. If you have diseases, then that's a separate question. You may have gastrointestinal diseases that prevent the absorption of specific nutrients from your food. You may have liver disease, which prevents the metabolism and the biochemistry of creating important compounds that we need in our blood. And you have to supplement in some of those situations. And there are other reasons for taking specific supplements medically, but in general, the answer is no, don't do it. If it makes you feel better psychologically that you took a multivitamin pill and it makes you happy, then that's a reason for doing it. But you have to know that you're doing it for psychological reasons. You're not doing it for medical reasons. As long as you're aware intellectually why you're doing it and you don't mind the expense, then by all means don't stop, especially if it's a habit that you've done for 20, 30 years. Any other questions at all that anyone has?
I had a question. Can you hear me?
Yes.
Oh,
Yeah,
okay.
we can hear you.
Yeah, I was trying to ask it before when you're talking about the water. So I see a nephrologist now because my function's been gradually getting worse over at Cedars. And every time I go about every 3 months and they do all my blood work. And so I guess sometimes she goes, well, you're probably not drinking enough water, enough fluid. You need to drink more. That's why your creatinine is probably higher today and your EGFR is worse. How much water are you drinking? But you're saying it doesn't matter?
No, what I said is in a normal human
Oh,
without disease, you only need to rely on your thirst. If you have an underlying medical condition, whether it's heart, kidney, liver, in those situations, you have to think about the intake more than just going by your thirst. Sometimes, not all the time. Now, when the creatinine fluctuates in someone with CKD, the nephrologist often will say, oh, it bumped up because you didn't have enough fluid.
mm-hmm.
If you drank more fluid, it would be lower. That may or may not be true.
Mm.
It's a common statement that they make.
Yes.
Remember also that the creatinine can go up because you ate more meat or fish that day. There's creatinine
Mm-hmm.
present in meat and fish.
Mm-hmm.
If I eat a steak tonight, my creatinine is going to go up, and it has nothing to do with my kidney function.
Yeah,
So
I usually try to fast before I'm like, I'll eat dinner
Okay.
and then they'll do my blood work the next day. And I try to at least 12, 14 hours minimum
So
without eating.
that's smart. You should always get fasting blood work when you go, not just for lipids or for
Yeah.
cholesterol. In general, everyone when they get their blood work, it should always be fasting, and that way you don't get the dietary fluctuation.
Yeah. Because the other thing was she did try me because it was gradually been going up. So they wanted to try me when I got to, like 1.6 to 1.8 creatinine and EGFR of like 32 goes down to 28 sometimes. They put me on Farxiga, but then my creatinine went up to 1.9 and my blood pressure just crashed. It went down to like, oh my God, like it was like 83 or 86 over 53 or 56. I was so tired I could barely even exist. I mean, so
Right,
yeah,
that's
it was
what I was saying with Farxiga. The problem is the creatinine goes up, and then the doctors stop it. They don't leave it on long enough to be to break through that initial issues you're talking about. These things happen initially, but over time, everything goes back to normal.
But what about the blood pressure? I mean, I
Yes.
tried for like 5 days. I couldn't get it up. I kept drinking and eating salt, and I was feeling horrible.
Right. Well, if your blood pressure drops severely to the point where you faint or feel horrible, tomato juice is the best thing to have.
Yeah, I was eating. She said eat salt, which I was doing, but it still
No,
didn't bring
the
it
salt,
up.
the amount of salt in tomato juice is more salt than you'll be able to eat on your own.
Oh, really?
It's a
Okay.
very salty drink. And so people
Yeah.
tend to have lower blood pressure. Um, I mean,
But then,
severe enough to faint. A quick around is to have a glass of tomato juice.
yeah, but the other thing she told me was, well, at least her physician's assistant said, "Oh, that's really dangerous to have such low blood pressure for an extended period. That could actually damage your kidneys
No,
more
no,
because
no. I mean,
you're
if
not
you
getting
if
blood flow to your
you don't want
kidneys."
to have a blood pressure of 80. In that particular case, you have to significantly increase your salt and water intake to match,
Yeah.
because that the drug causes salt and water loss in your
Hmm.
urine. It's like a diuretic.
Yeah, and it also lowered my sugar down to 80 something too,
Yeah,
from
it
usually
drops
like
your sugar.
98.
It makes more
Yeah.
salt and water and sugar come out in the urine, and your blood pressure drops unless you match that with increased salt and water intake that's
Yeah,
sufficient.
I was doing increased water. I usually drink like 5 or 6 glasses of water a day. I was trying to do like 8 or 9 glasses of water
It's
a
more the
day, and
salt. It's more the salt. You have to
more
really
this.
increase the salt, and then the water will be retained with the salt. You don't have to try to do it on the water
Yeah,
side.
I know, but she did say having low blood pressure for an extended period like that could actually damage your kidneys and other organs because they're not getting blood flow.
Well, at 80, 85, it won't damage. If it gets to 60 or 50, it'll damage.
Oh, yeah,
But,
yeah.
but you don't but you don't want to have a blood pressure that low anyway, because
No,
you can
I
faint
couldn't. No.
you can faint and fall
Yeah,
and break a hip.
right.
So
Yeah.
that you don't want.
So I don't know. They're reconsidering putting me back on it, or maybe I don't know. Or they said they
Or
could try.
maybe a lower dose.
Well, they had me on half of it on 5.
Well, you
Five.
know that if you go on it again, you're going to have to significantly increase your salt intake at least
Right, and
for the
see.
first week.
Yeah, exactly. Ugh.
Yeah, it'll happen again.
Yeah, they also have me on an ARB, 25 milligrams of losartan.
Well,
So maybe
that's also dropping your blood pressure.
well, I know that keeps it normal though. When I'm on that, I have a really good blood
Right,
pressure
but
of
if
like,
you're on Farxiga and the ARB, your pressure is going to drop. That's predictable.
so exactly. So what do I do? Go off the blood pressure med? They
Well,
said
the
I should.
next time it happens, ask her if you can go off the ARB.
Well, I know my internist said it's more important. He thinks to be on the ARB than the Farxiga. So he said just stop the Farxiga and stay on the ARB. ARB. He said
Yeah, it depends what experiment you're doing.
That's kidney protected.
If the
Yes.
experiment is to try the Farxiga to prevent the CKD progression,
Mm-hmm.
the ARB can be definitely decreased if it's causing with
Yeah,
the.
well, I think 25 milligrams is the lowest it comes in unless I break it in half, I
But
guess,
she can stop the ARB and then
Stop it.
Do the Farxiga experiment again with a much
Oh.
higher salt intake.
And don't do the ARB at the same time. Just stop taking it.
Stop the ARB a number of days before.
Yeah, because that does keep it, my blood pressure really good. Yeah, I'm very stable with
But
that.
it's a dynamic situation.
Ugh.
You're doing it as an outpatient. It's not something easy
Yeah,
to
I know.
change.
Yeah, I know.
Also.
Yeah, I know. And then Jardiance, I guess, is basically the same thing. They said Farxiga is a little, maybe
Yeah,
has
no, they all
better results.
they're all
Oh,
SGLT2 inhibitors.
yeah, exactly.
They blocks the sodium
Right.
glucose co-transporter.
Right, right. All right.
All right, everybody. I think it's time to ingest more protein and potassium. So
Well, my
and water
protein and potassium,
and
they're
salt.
good. They're good. They're good.
But thank you very much for joining. And if you have any questions, just email Leslie and I'll try to get back to you.
All right, thank you very much.
Thank you so much.
Thank you.
Thank you.
Okay, thank you, doctor.
Okay.
Bye-bye.
Bye.
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 Thank you.